The diagnosis of mental illnesses in children is based on primarily signs and symptoms that the family and others who are involved in the child's life find throughout the day and how the condition affects the child's daily life. There are no simple tests or procedures to take to know whether or not this child has this illness, but again, it's just throughout the symptoms and the signs that parents and other caretakers see in the child. Severe mental illnesses, which are also known as SMIs, are mental behavior or emotional disorders that result in function impairment, which substantially interferes with the child's daily life and how they get through major life events in their day-to-day activities. It is found that 1 in 10 youth has serious mental health problems and that they are severe enough to impair how they function at home, at school, in the community, how they interact with their peers one-on-one. Symptoms and behaviors that require inpatient treatment include that the child is a danger to themselves or to others through threats or through aggression. They are in need of stabilization due to out-of-control thoughts, feelings, or behaviors, such as suicide. They are in need of medication management, whether that be having someone plan out when to take each medication, the types of medications that they might need, and at what times, beyond what can be done through visits with a psychiatrist. And that they are experiencing increased mental health problems despite the outcare patient treatment that they are receiving through doctor's visits every once in a while. And then there is such cases in psychosis, where they experience hallucinations and delusions, or that they are causing harms to themselves through neglect, which can mean that they are not eating, they are not getting enough nutrients that they need throughout their day, and there's a failure to eat, or engage in self-care, including hygiene, taking care of themselves if they hurt themselves, getting the right proper treatment to make sure there is no infections, such as that. There's also, in all of these mental illnesses, there are many types of ones that can be diagnosed. Illnesses include anxiety disorders, attention deficit hyperactivity disorders, which is also known as ADHD, autism spectrum disorders, there is mood disorders, and schizophrenia. And all of these, in the right severity and in the right circumstances, all experience such symptoms that I listed earlier and would require inpatient treatment at a hospitalization center. Children who experience anxiety disorder, which can also contain obsessive compulsive disorder, which is OCD, post-traumatic stress disorder, social phobia, and generalized anxiety disorders, experience anxiety as a persistent problem that interferes with their daily activities, and that causes them to feel a sort of panic that most people would not feel who have not been diagnosed with such mental illnesses on a daily basis. It's a persistent thing that continues throughout their day. With disorders such as post-traumatic stress disorder, patients can experience excessive anger and hatred, which can result in physical altercations, which in some cases in children who are strong, it can be a threat to themselves, and it can be a threat to people surrounding them at that point in which they experience these excessive anger and hatred feelings. They can also experience hallucinations, negative thoughts and feelings, and sometimes they even experience lapses in memory. Attention deficit hyperactivity disorder, ADHD, includes the difficulty of paying attention, hyperactivity, and impulsive disorders, impulsive behaviors that they have an urge to do something and they just have to do it, and they can't control that urge. While not all people who are diagnosed, not all children who are diagnosed with ADHD experience all symptoms of impulsive behaviors, of inability to pay attention, and hyperactivity, there are some who do experience all of these symptoms. Impulsive behaviors can be generated from feelings of insecurity or aggression, or are sometimes just brought forth by the thought or perception of a threat. Some people might not try to give off a certain feeling towards someone else, but they can be threatened by that. And it's just how they perceive it because of their condition. There's also the autism spectrum disorder, and this is a very broad spectrum. It can range from fairly competent to very severe. People can, with this disorder, can take care of themselves. They can do what they need to do throughout the day. Others, they need constant help throughout their day. And this developmental disorder usually appears in early childhood, usually before the age of 3. The symptoms and severity can vary, but ASD, which is autism spectrum disorder, always affects the child's ability to communicate and to interact with others. Many children who are diagnosed with autism and many children who are faced with any mental illness across the board will face ABP, which is aggressive behavior problems, and this is the primary cause of residential placement among children. Because of their inability to communicate with others, because of their sometimes inability to perceive things in the way people are showing to them, they get upset, and it can cause outbursts, and people don't always know how to handle these. Another illness is mood disorders. Mood disorders include depression, bipolar disorder, and can cause a child to feel feelings of sadness, extreme anger, mood swings, much more severe than normal. These mood swings can include positive and negative emotions and feelings. The most common disorder among mood disorders that people normally see is the bipolar disorder. This includes 2 major emotional states, and there's also a third one. The first one is manic episodes, which these include feelings of being overly joyful. They have feelings of being overexcited. Another episode is depressive episodes, which exhibit extreme sadness and hopelessness, and can and at most times will include explosive and irritable moods. And then the third one, which is not as common among people who have this disorder, is called the mixed state being, which is pretty self-explanatory. It is both manic and depressive episodes, so you feel both overly joyful and then depression all within a short time period, but that is a lesser common of the 3. The last mental illness that is in severe cases requires psychiatric hospitalization is schizophrenia. This chronic mental illness causes a child to lose touch with reality. They can't decipher what is real and what is not real. The technical term for this is called psychosis, and it usually appears in the late teens through the 20s. All of these mental illnesses that I've listed are treatable with the right help and the right care. With the proper supervision and the proper professionals to help in the process, we can see astounding results in the improvement in the child's behavior, and their feelings, and how they live their day, and their ability to care for themselves. 75 to 80% of children and youth in need of mental health services do not receive them. And it's a sad reality, but sometimes the homes of these children who face these mental illnesses are not properly prepared to care for the children. And that's what inpatient treatment centers are there for, to help the child in success, and the family in success, and to get the care that the child needs, and to reach the goals and the recovery that the child needs. Treatments in inpatient facilities can usually differ depending on the mental illness, the severity of the illness that they're facing. But everyone has a routine, everyone has a goal that is set when they come in, and it helps them in their current situation where they're at, where they're starting, and then they set a goal as what do they want to happen at the end. Some treatments include one-on-one sessions with psychiatrists and psychologists or nurses, and these sessions they usually talk to the child, assess how they're feeling, assess their emotional state, and then from there they take their action plan as to what needs to happen to see the recovery in this child. There's also occupational therapy, medication plans, which we mentioned earlier, which includes the administration of the medication, the types of medication that's needed, when and where and what times. And then there's also an electroconvulsive therapy, And this is a non-harmful, but there are electrical currents which are passed through the brain to treat severe depression, mania, and schizophrenia. This is safe, it's painless, and it's a very effective treatment. Some, if not most, of these treatments are not readily available in homes of patients, and therefore the stay in inpatient facilities plays a very key role in the healing and recovery of mentally ill patients. The issue of child custody relinquishment is a very heavy one, and with the emotional state of all these children and the mental illnesses that they face at these points in their lives, they're at a very sensitive period in this time. And so it is up to us to make sure that we can do all that we can for them, and to make sure that we do not separate them from their families in this already emotional heavy time, because these children don't need to face the more emotional stress of being separated from their families, the ones that they know, the ones that have been taking care of them. So I believe that inpatient facilities are the key to helping these children succeed later on in life, but we need to go about it in the right way to make sure that no one else is hurt in the process, and that we don't damage the child even more than what's already happened.